Hello, everyone. Welcome to Backyard Musings, broadcasting live from Apple Valley. I'm Steve. And Scott, I have proof of life. He is still sick. He and his wife, they got hit hard with the cold. Here's a text from Scott last night. Hey there, don't send the search party. That's typical Scott right there. We're dealing with our colds as best we can. Lots of rest and meds. Not much better, but getting there. Thanks for reaching out. So, he's sick, still sick. They must have got hit hard with a bug, with a flu bug or something like that. So, we're gonna carry on as we do, and it's like that lighting is just not. Ugh, like it's blinking or something. Okay, we're gonna carry on. Recent chain store closures have led to an unprecedented decline in pharmacies, according to researchers from University of Southern California and UC Berkeley. The rate of pharmacy closures has more than doubled in recent years, with approximately 1 in 3 pharmacies shutting down. Check this out, between 2010 and 2021, resulting in a significant reduction in pharmacy availability nationwide. 2010 to 2021. About 1/3 of U.S. countries saw a net decline U.S. counties saw a net decline in pharmacies, with predominantly Black and Latino neighborhoods facing higher risks of closures. Independent pharmacies, often excluded from pharmacy benefit manager networks, were more than twice as likely to close compared to chain pharmacies. So, what here in California, I think of immediately that bonehead law that we had. You could steal up to $985 and it'd be a misdemeanor, and police in the big cities wouldn't prosecute it. L.A., San Francisco, San Diego. I myself watched a long time ago, right around the 2010. No, that's not 2010. It was about 2017. I watched as a lady walked into a CVS in San Francisco, and she just went over to over the counter meds, opened it up, put it in her pocket, and walked out. And the people were just like looking at her. So it was crazy. I was incredulous. I don't do things like that. Scott and we are Christians. Thou shalt not steal is a commandment that we keep. We keep all of the commandments. So, all right, let's get back from that diatribe I was on. Policymakers should explore strategies to expand pharmacy participation in preferred networks, especially for Medicaid and Medicare Part D plans. Would you like to know more? Nearly 1/3 of U.S. retail pharmacies have shut down since 2010. Now, the reason I said that is that's about when Obamacare. When did he get elected? Did he get elected 2008? Took office 2009. Yeah, and he was in power for 8 years. So with Obamacare, with most states experiencing a significant decline in drugstores in recent years, according to a new study by researchers from USC and the University of California, Berkeley. These closures pose a serious threat to public health, making it increasingly difficult for people to access prescriptions and critical health services. Published today, well, that was December 3rd. Today, I don't know, what is today? 5th. Yeah, so that was on the 3rd in the journal Health Affairs. The study examines the local and market factors driving pharmacy closures between 2010 and 2021, with thousands more closures anticipated in the future. The researchers provide insights to identify communities most at risk and suggest policies to help preserve access to essential pharmacy services. Quote, at the same time, many states are making efforts to expand the scope of pharmacy services beyond dispensing drugs to include the provision of preventative and emergency care. We found that there are, for the first time for at least a decade, fewer pharmacies available to provide them, end quote, said senior author Dima Mason-Kato, a senior scholar at the USC Schaefer Center for Health Policy and Economics and the Hygieia Centennial Chair. Wow, an associate professor of USC Mann School of Pharmacy and Pharmaceutical Sciences. Well, this is a pedigree. This is a pedigree person, so listen closely. But when I was saying that stuff, when I was reading it, I remembered the local drugstore down the corner from where I grew up. Rexall Drugs is what it was called. RX All Drugs. And That's closed down since went back to Bay City, and visited Bay City, Michigan. Closed down. Not there. The big pharmacies have taken over. All right. For most of the decade of 2010, pharmacy openings in the U.S. outpaced closures. And in previous work, the researchers found that pharmacies closed at a much slower rate during the first half of the decade, with 1 in 8 drugstores shuttered between 2009 and 2015. Their new study finds an unprecedented decline in the number of pharmacies began in 2018, primarily driven by closures of chain pharmacies during the active period for industry consolidation. Well, you consolidate in order to synergy, buying power, um, cost cutting expenses. Uh, this included the merging of large pharmacy chains with dominant pharmacy benefit managers, PBMs, pharmacy benefit managers, which negotiate prescription drug benefits and steer patients to preferred pharmacies. Like out here, we've got Kaiser, and we're on the Kaiser plan, Cherish's work, and we can't go to any pharmacy other than Kaiser Pharmacy. And I tell you, that pharmacy, there's like 6 pharmacists and like 3, 4 techs that are working. Man, I don't know, maybe 6. I mean, it's a hopping pharmacy, um, as compared to the mom and pops. Researchers identified pharmacies using a registry maintained by a national nonprofit and linked the data to county and neighborhood level data from the U.S. Census Bureau and National Center for Health Statistics. Among their findings, between 2018 and 2021, the number of pharmacies declined in 41 states. That's staggering. During the entire study period, 2010 to 2011, nearly 1/3 of counties experienced net decline in pharmacies, affecting 91.6 million people. 1/3 of all counties in the United States. That is ridiculous. That is crazy. In 7 states, more than half of counties experienced a net decline in pharmacies. Illinois, Maine, that's right, I said Illinois, so don't give me any crap. Maine, Mississippi, New York, Pennsylvania, Rhode Island, and Vermont. At the community level, pharmacy closure rates were higher in predominantly Black and Latino neighborhoods, 37.5% and 35.6%, respectively, than predominantly white ones, 27.7%. That is like a 10%, 8 to 10% closure rate. Huh. The last finding is partly explained by the struggles of independent pharmacies, which were more than twice as likely to close as chain stores. That's understandable. They were also much more likely to be in Black, Latino, and low income neighborhoods, as well as those with disproportionate rates of people with Medicare or Medicaid coverage. Quote, our findings suggest that closures may widen health disparities in access to prescription and other essential pharmacy services, such as vaccinations and pharmacist prescribed regimens, including contraceptives, medications for HIV prevention, and treatments for opioid use disorder, end quote, said first author Jenny Guadamuse, an assistant professor at UC Berkeley School of Public Health and the Health Equity Program Director for the UC Berkeley Center for Wealth Management and Policy Research. I see that word equity and I'm like, that gets me nauseated. Quote, without safeguarding pharmacies in marginalized neighborhoods, expanding healthcare services at pharmacies may enhance convenience for more affluent populations while failing to address the health needs of communities disproportionately affected by pharmacy closures, particularly Black and brown populations in low-income urban areas, said Guadamuse. Thank goodness we have a regime change January 20th. A high tide makes all the boats rise. All right. Under Trump, his first administration, record employment rates in these Black and brown populations. So hopefully we'll see that again. People making money, businesses starting up, continuing, flourishing. Hopefully we'll see that. Goodness. Quote, as highlighted in a recent FTC report, a key factor contributing to the higher risk of closure for independent pharmacies may be their frequent exclusion from preferred pharmacy networks. Yeah, said Guadamuse. PBMs use preferred pharmacy networks to encourage patients to visit certain locations by offering lower cost sharing or out of pocket costs. The recent mergers of likely pharmacy chains and PBMs also likely contributed to low reimbursements from PBMs at those combined to companies' independent pharmacies and rival chain pharmacies, the researchers added. I remember when Rite Aid was merging with Walgreens for the longest time. They were closing stores and then they brought it back from the brink of bankruptcy. The researchers said federal and state policymakers would consider policies that would increase the participation of independent pharmacies in preferred networks. This could include mandating Medicare and Medicaid plans to give preferred status to pharmacies at heightened risk of closure or those serving pharmacy deserts with reduced access to pharmacy services. I guess like that's a pharmacy that's hardly any pharmacies around or in like rural small communities. In the commercial market, federal and state regulators should also consider requiring that PBM's preferred networks do not disproportionately favor pharmacy chains, including those part of the same company, the researchers said. That'd be like Kaiser. Federal, state, and local policies and programs should consider targeted strategies, including increases in Medicare Part D and Medicaid pharmacy reimbursement rates to protect critical access pharmacies most at risk for closure, particularly those serving neighborhoods that are or are at risk of becoming pharmacy deserts, Cato said. So I know a lot of our viewers are in that demographic that's like my age, like from the 50s to 60s, 70s. We've got a lot of those viewers. So hopefully they found this, well, interesting. But yeah, I hope they can solve this dearth of pharmacies so that people can get medications that they need, especially Scott and his wife. Not sure that we'll see them we'll see Scott this afternoon. Not banking on it because he's down and out, but I definitely want to go visit him, maybe give him a blessing, see if he can get better from the blessing. Scott, you're probably listening. We love you, man, and we miss you. We want you back badly. So I'm like struggling here by myself. All right. We'll see you this afternoon. What's the segment this afternoon? I'm cranking them out so fast I can't even remember. Oh, it's about another chemical thing, turning CO2 into energy that's usable. It's pretty cool. All right, I'll see you this afternoon.